morning. So I'm gonna perform an incentive spirometry. So first and foremost, make sure we check the patient's chart, obtain any information from the patient. And then before going inside to the patient's room, you should wash your hands, and then we will wear appropriate PPE such as gloving. And then once we go inside to the patient's room, make sure we always introduce ourselves to the patient and then tell them that, such as for example, that good morning, my name is Anthony. I'm a respiratory care student from the respiratory department. So the doctor ordered incentive spirometry. So this one is a non-invasive procedure therapy. So this one would help you expand your lungs, and then it would also relieve or prevent any secretions to stay inside your lungs, and also it would help them open up their airways and also prevent their lungs to from atelectasis or being collapsed. So after that, make sure when looking at the device, we should inspect this one for any cracks, especially on the bottom. If there is, make sure we always replace it with a new one. And then after that, we should do our assessment to the patient, make sure we obtain any vital signs. And then one of the things that is important when doing this therapy is we should always do our auscultation. So once we're done, we always reposition the patient. If the patient can sit upright, that would be better. If not, we can just adjust the patient's bed. And then after is every time we do this therapy, we should always do a demonstration for the patient to understand, such as first we should remove this one, and then should be, when holding it, it should be holding it like this. And then if, for example, I am the patient, we should base it with the age and the height. So mine is about almost 2000, so we should set it that's in this level. And then first is we should let the patient exhale all the air out until you feel their lungs are empty. Then after that, put this one, the mouthpiece, inside, and then let the patient take a slow deep inspiration. And then after taking a slow deep inspiration, we sense this white piston to rise. After it reaches its maximum, where it's appropriate for their height and age, they should take a breath hold for about 3 to 5 seconds and remove and exhale. So first, exhale all the air out. Once the white piston would drop until this one, to the lowest one, they should remove the mouthpiece, and then they should exhale normally. Ideally, we should let the patient start about 10 breaths per hour, but for in cases like those for the initial treatment or their first trial, I would recommend it started about 5 trials and then gradually increase it, so that way we can prevent those complications such as fatigue, discomfort, or even lightheadedness. And then every after attempt, let the patient rest for a few seconds. If they can cough, that would be better. Allow them to cough, and then we can also facilitate by having a percussion and manual percussion in the back so that they can expectorate if they have secretions present. So once they're done, also the patient should be able to practice this also, not just during every night, because it's not ideal during every night, because ideally this should be done for patients who is fully awake, who is conscious and coordinated. And also they can also use this one every hour so that they can practice it even more. And then if some instance, like we have some patients who just came from surgery or experiencing any pain, we can either put something in front, such as a pillow, that would help support themselves from any discomfort or pain when performing this device. So there's a pillow in place, and you should hold it like this. So every time you're done, be sure that we set this one, put it in this plastic, and then we should put it on the side. And then every time we're done doing this therapy, make sure we remove the PPE such as the gloves, and then take note of the color consistency of their sputum, and then obtain vital signs. Make sure we do again another round of auscultation, which is important for incentive spirometry. Then once outside, make sure we chart it, what we observe to the patient, if how much pressure or volume the patient was able to reach or tolerate during their attempt, and then make sure we always coordinate with the healthcare staff or the physician.